Hello, welcome to Awesome New Things. I'm Jason DeSombre with Select Physical Therapy and PFX Golf. We're going to go over today is it's that time of year where the weather is actually starting to cooperate and you can actually get outside and start hitting golf balls. One of the biggest things we run into as a physical therapy or a fitness component is trying to make sure we're not injuring low backs heading back to the range, particularly with hitting a lot of golf balls. So we're going to go over a couple screens today to hopefully give you guys a simple way to screen yourselves and see if you should be hitting a bunch of golf balls or if there's more of a stretching program you should do before hitting balls. I'm here with Dave with Awesome New Things. I want to take you through a screen to be able to see if anything's going on with the hips or with the thoracic spine. A lot of people think that the low back is really the product of something that just hasn't been trained properly or you haven't hit a lot of golf balls. In reality, what really happens is a lot of people have restrictions in their hips that will affect your low back, or they won't have enough flexibility in the thoracic spine that also affects their low back. For this, all we really need is a 6-iron and another club. The industry standard for a 6-iron is about a 60-degree angle. So we want to lay this on the floor. Use the other club as a reference, and then Dave step right in here. He's going to put one foot up in the air, or excuse me, one heel towards the back. And I'm going to have him try to rotate towards me as far as he can. With hips and rotation, good. And you see that Dave is well short of that 60 degrees, so that's something we want to look at. Now we want him to do a switch feet. And he's going to do the same thing. Now we're going to test this way and see how he does on that side. So that side's a little better, but also just shy of that. So we'd also want to check him on his opposite side as well to make sure both the right foot and the left foot have as much flexibility on both sides. The next thing we're going to ask him to do is come to the edge of the table. We're just going to take a thumb across your back. Just hold on that for me, Dave. Good. Now what we want to try to do is see how much thoracic rotation he has. So I'm going to have him put his knees together, nice and close. And he's going to try to rotate as far as he can to the left. And you'll see here that he's well past that 45-degree angle. And then I'm going to have him rotate to the right. And you'll see how far he gets past on this side. So Dave's done really, really well with this test. One thing we'd really like to try to address with someone like Dave is make sure that he has enough hip flexibility before he goes out and hits a lot of golf balls. So again, if you had any problems with any of those exercises, particularly with pain or really felt any discomfort with that, I would definitely try to seek out the help of a physical therapist, particularly one that specializes in golf injuries. If you just had some restrictions and felt like you probably lacked just a little bit of mobility, you'd probably want to seek out the help of a Titleist Performance Institute certified specialist. They should be able to give you some exercise that hopefully will address these weaknesses. Other than that, I hope you guys have a pain-free and a wonderful golf season.